Suicide is one of the leading causes of death, and the rate of suicide related death is increasing worldwide. Suicide is associated with significant social, economic, and health system cost. Although several intervention strategies are in place to prevent suicide, still the overall suicide rate is still high in Canada and as well in the world. Suicide is a complex and multifaceted health and social phenomenon that needs an immediate response that is collaborative, comprehensive, compassionate, and evidence-based. The phenomenon operates at multiple levels, which ranges from individual behaviors to peer interactions to community characteristics to local, provincial, and federal public levels. Such different levels interact with each other and have a significant impact on how the suicidal behavior evolves over time. The traditional scientific approach examines phenomena along with some associated factors, whereas system science approach examines the relationship between interconnected components of a system by using empirical data related to the system. Dynamic models are mathematical models that are used to describe a system that evolves over time by studying the interrelated components of a system. Since the suicidal behavior is dynamic and complex in nature, therefore, the phenomenon needs system science approach to understand the individual and aggregated components of the system. Although dynamic models have long been used in epidemiological studies to model disease outbreaks and guide public policy, as many of you have seen in the context of COVID-19 pandemic. But the use of such models with more complex social behaviors such as suicide and self-harm behavior is limited. There might be several components of a system where gathering information is limited or not possible due to its nature. For example, in real life, it is not possible to know how many people actually attempted suicides and how many of such attempts ended up in hospitalization. In recent years, machine learning algorithms have become popular in estimating disease transmission models or dynamical systems models. Such algorithms can be useful in estimating model states as new empirical data becomes available in the dynamic system, especially estimating latent states along with some observed states. That means the latent states means total number of people planning suicide or considering suicide, and the observed state means that the total number of people actually died by suicide. The information about these states may help public health agencies or healthcare authority to assess different interventions and recommend early intervention support to people at risk. In my PhD thesis, I am aiming to provide a tool to estimate and predict the dynamics of suicide by applying machine learning algorithm in dynamic models while combining data science by mitigating important weaknesses of each of these methods. Thank you.